is Dr. Elizabeth Kimani-Murage, and I'm a senior research scientist at the African Population and Health Research Center. I lead work on maternal and child well-being, and particularly maternal and child nutrition. But more recently, I have been quite involved in the area of food. So I'm promoting the right to food. I grew up in Kiambu district. Then it was called district, but now it's called Kiambu County. And I grew up in a modest Christian family, and we did some bit of farming, subsistence farming. I remember that because I was of course we were involved in that farming, and my mom used to give me a small part of the land, small portion of the land for my own farming. And we grew food first to feed ourselves, and then we also shared with people around us in the community. And then we also sold whatever was excess. And so my family, we were 9. We are a family of 9, so it's a big family. But I grew up with 4 of my siblings. The others had grown up earlier before us, so I didn't interact a lot with the other 4. I interacted with the other 4 who grew up at the same time with me. Yes. So I went to a nearby school near our home. It was called Fadhi Primary School, but it's spelled with a B. But in Kikuyu, we pronounce B as F. So Fadhi Primary School. And I was a small girl when I was growing up. Of course, everyone is a small girl, but I was particularly small. Those were days when many people used to repeat. And for me, I didn't repeat in any of the classes. And so I was in classes with very big people sometimes. I was a relatively bright student. I used to top my class most of the time. And so my stay in the school was quite enjoyable generally, because teachers seemed to really kind of favor students who were doing well. When we did KCPE, the Kenya Certificate of Primary Education, I was top. I was the top student, and so I was admitted to a national school called Loreto High School Limuru, which was one of the top schools at the time, national schools. And I spent my 4 years there. Of course, there was more competition than I ever had in high school, because people came from different backgrounds. They were top in their schools. And so there was quite a bit more competition, but I also still did very well as I went through the studies. And I passed well enough to go to the university. And so I was admitted at Moi University. I was admitted to do a BSc in environmental health, which equates to public health. We were the pioneers of the program, the environmental health, the BSc in environmental health. When I was growing up, my mom always impressed on me that one day I'll be a judge, probably based on how she saw me thinking or arguing things or deciding things, or also because we were, as a family, we were involved in a long court case that I experienced that the whole of my childhood. Like for 20 years, we were involved in a court case on regarding land. And so probably because of that exposure for her with court issues, she thought then maybe how she had observed the judges making judgments and all that, she thought I would become a judge. But then other people thought I would become a doctor. And of course, that's what many people, when you're growing up, people want you to be what they think you should become. And so many people often told me, oh, Wamboi. Then I was called, now you call me Liz, but when I go home, they call me Wamboi, and they were always like, Wamboi, you'll be a doctor, all that. So when I was admitted to Moi University, the course sounded close to medicine in a way, because it's public health. Just so I was in the town campus in Moi University, where we were with the medical students. So for the first year, we actually attended the same classes with doctors. So we did the same things, but we split in second year when they did their other courses, and we now started specializing in courses in our field. Yeah, so I finished the course, the BSc course in Moi University, and then I graduated and I started looking for a job, but then I realized that it was very hard to get a substantive job without a master's. And whenever I looked for a job, I saw the adverts indicated that they wanted someone with a master's of public health. And I realized I cannot waste any time. I went back to university the following year and went to do Masters of Public Health in the same university. And so, yes, I got Masters of Public Health. And then after I finished, I got a job, and after some years, I went back to the university and I did PhD in public health, specializing in nutrition. And that's how I started working on issues of nutrition. As I was growing up, I knew some people who are in science, but there could have been some influence then. But I was more influenced when I went to the university. So when I was growing up, I used to see someone like Wangari Maathai and the work she was doing, and that was interesting. As I grew up, when I was maybe a adolescent teenager, when I was in high school or when I had just finished, I remember some people telling me, Wambu, you'll be like Wangari Maathai, kind of thing. I don't know, for some reason, there was that kind of association at some point. Probably they saw something that resembled. But when I went to the university is when I actually got interest in science, really. And I know I was good in science in sciences. When I was in like primary school, I did very well in science. But when I went to university is when I got that interest. As I said, I was admitted to do BSc in environmental health. The program at Moi University town campus, they used a different approach to teaching, and it was called self-directed learning. And in self-directed learning, we were expected to do a lot of work by ourselves. We do a lot of research, desk review. You go to the library, you look for information. You go to computers, you look for information for yourself, you teach yourself, then you meet as students in a group facilitated by a lecturer, you discuss what you have found. So it was very research-oriented kind of study. And within the program was also something we called community-based education system. In that year, we were meant to go to a community for 6 weeks. You stay there in the community, you stay with them, you learn their life, what they are doing, the social issues, the health issues, and you do research on that. So you interact with them, you help them in the community about their health issues that they were experiencing, but at the end of the day, you do a research report. So that really exposed me to research. And then in fourth year, we were expected to do now a formal research where you actually start with deriving a protocol, and then you go to the field and collect data systematically, and then you analyze that data and you document it, you report it. And so in 4th year, I did a research which I was assessing the quality of water slum dwellers in Langas in Eldoret were using. And so all that exposure really gave me a lot of exposure to research. But during that time when I was a student, I also worked with professors in the university in their studies. They were funded to do some studies. Like I remember when I think it was in 3rd year, I worked with a professor who was doing some work on quality of life. It was a World Health Organization kind of study, and they were establishing the quality of life of people. And so I was involved in collecting data with people, and at some point I was also involved in analyzing data with one of the professors. Yeah, so for me the exposure was especially during my undergraduate studies, and that's when I got interested in epidemiology, because the people I worked with, several of them were epidemiologists, and I got interest in epidemiology. And so when I thought of what I should study for my master's, I wanted to do something that relates to epidemiology. And epidemiology is the study of disease distribution. So you study diseases and how they are distributed within the community. You know who is more affected and all that, and what are the factors that affect the distribution of the disease. And so when I wanted to choose for master's, I went to do Masters of Public Health, because as I told you, as I looked for jobs everywhere, I was just seeing you need to have Masters of Public Health. But then I specialized in epidemiology and disease control. Yeah, so generally that's how I got interested in science. But then, I mean, the story is long, because I can talk more about how I really now got involved. I would say that I'm a career mentee kind of thing. I have been mentored so many times through my life, my journey in my career. But let me say more formally, from the time I got my first job. So I got my first job at the African Population and Health Research Center, APHRC, and I got the job as a research trainee. So the research traineeship program was a mentorship program where people who had just done masters were mentored into PhD, like they were prepared for PhD studies. And so during that time, I was mentored by several people who are at APHRC towards gaining good skills in research, which would help me to get a placement for PhD and to be a successful PhD student. Then I got a doctoral fellowship to study PhD at the University of the Witwatersrand in South Africa. And I was mentored, because when you're doing a doctoral program, you get supervisors, and they were also mentors for me. So that was kind of also a mentorship where I went through the studies. And then after my PhD, I came back to APHRC as a postdoctoral research scientist. And that's also a mentorship program. So I got the postdoctoral fellowship at APHRC, but also I got a fellowship with the Wellcome Trust. Also, it's a postdoctoral, so which now paid for my time at APHRC during my postdoctoral fellowship. And so being a fellowship, I was assigned mentors. So I had mentors, two from the UK, who are my sponsors through the Wellcome Trust Fellowship. I had one from South Africa who was my doctoral mentor. And then I had a mentor from APHRC who was my supervisor. So I really had all those mentors, and I got through all that mentorship, and I have also just finished another fellowship after that mentorship. After that mentorship, then I have grown to become a senior research scientist at APHRC. But more recently, I got another fellowship, and this is different. It's not a research fellowship. It was a public engagement fellowship with the Wellcome Trust. And this was also a mentorship kind of program to become a public engagement ambassador, and which has opened my space. So as a researcher, of course, you're meant to really engage the public, the policymakers, and everyone. But that really opened up for me the space for engagement, and it was a mentorship program. Through that, I was allowed to have a coach. Then maybe it changed more from mentor, but to coach. So I had two coaches during this fellowship, and one was a communications coach who coached me on communications to be able to communicate my work, science, any communication appropriately and effectively. I also had another coach who was a career coach, or a leadership coach, just to mentor me through leadership, mainly through leadership. I mentor a lot. I have been mentoring a lot. I supervise students from first as a supervisor. I have supervised several students at master's level, at PhD level. And so several students have gone through my hands, and I mentor them. And also at APHRC, I mentor a lot of junior researchers, early career researchers who need my mentorship. So one of the things, when I have done assessments, there are some assessments we do at APHRC, leadership assessments and all that. One of the things that have come up strongly is that I do well in mentorship, and I'm really keen on mentorship because I have really been mentored myself. As I said, I'm a career mentee. All through my journey, I've been mentored, and I really want to pass it on to others. And so at APHRC, in my unit, which I had the maternal and child well-being unit, we have established a mentorship program. So to mentor junior researchers, but towards research excellence, and also towards their further studies and career progression. So generally, I mentor a lot. I think there are a lot of opportunities. First, starting with research opportunities, a lot of things that people can study in, and so they can get involved in research. And as you have seen my career path, I started being a research trainee, and I have progressed to being a senior research scientist. And for me, the journey has been great, with a lot of learnings along the way. So for me, research is a good path for young graduates in science, because you learn a lot. Through research, you learn a lot, you get exposed to a lot of things, you get exposed to a lot of information, evidence, and you learn so much. And then you also get opportunities to engage the public, engage policymakers. So it's really a good career to take. But there are also opportunities in programming, like working with maybe the government or the non-governmental organizations, implementing organizations to implement programs. And then there is also the track of getting into policy, like working with governments, like it could be Ministry of Health, to really work to formulate policies. Yes, so there are a lot of opportunities. Of course, in Kenya, for example, especially, job opportunities are a problem. Many people interact with me, like through Twitter. They tell me they have been looking for a job for 2 years and they have not gotten a job. And I know one who told me he got a first class in his university, and he's still tarmacking, he's still looking for a job. So it's not easy. And as I told you, when I finished my undergraduate studies, I looked for a job for that during that 1 year that I stayed out, and I realized I could not just wait anymore. I had to add to top up my skills and my papers for me to get a substantive job. So I realized with 1 degree, it's difficult. It was difficult for me to get a substantive job, and I had to go back to school and top it up so that I could stand out. Yeah, so there are all those difficulties, but there are opportunities. They are always there. Okay, if I call my career path starting from when I was a student, like let me say when I was doing my undergraduate studies, as I said, I did a study when I was in 4th year, a research project. When I did my proposal, I wanted to do something that makes a difference, and I had a friend in an urban poor setting, that is Langas in Eldoret, that is a slum setting. And I used to visit them, and I used to kind of observe the kind of water they were using. The water was from a shallow well, and just next to the shallow well were pit latrines. And I was concerned about the kind of water they are using, and I really wanted to study that. So when I was given the opportunity to do a research project, I wanted to do a research project where I would take water samples and take them to the lab and evaluate whether they are safe, the water is safe for human consumption, to check for fecal coliforms and all those kind of things. But then funding was the problem. I remember waiting for several weeks, looking for a way to really be able to do that kind of study. And some students were like, why are you struggling so much? Why don't you just do something simple, like something you can do? Some of them said some people even do this under trees, so you don't have to struggle so much. But I really wanted to do something that makes a difference. But in that waiting and looking, I was very lucky to get some support. I was given support by AMREF. I learned they were also looking for opportunity for someone who would be able to establish the quality of water that the slum dwellers were using. They had a project in Eldoret, and their project was to promote safe water, like water through water kiosks, tapped water through water kiosks. But they needed evidence of what the situation of water in the community, and so then our interests met, and I got funding through them to do the study, and I completed the study, and it was published. I got to publish it when I came to APHRC. And the same thing happened when I was doing my master's, same issue of funding, but somehow I got funding for my master's. I got funding through the Care International, through their refugee assistance program. I also stayed for a long time before I could really make a breakthrough for funding, but I got the funding. I worked with them as a volunteer, and they supported my work. When I have been at APHRC as a researcher, some of the challenges are so they say you publish or perish, and so publishing work, being able to publish work, getting grants to be able to have projects is very critical for a researcher. And sometimes getting grants is really difficult. So a lot of times you get a regret when you have applied for a grant. Also, when you submit papers, sometimes you get negative response, you get a regret or rejections. So those are the lows, but there are so many highs in this career. Of course, when you get those papers published, when you get the the grants to do the work, you get success in grants, that's a happy moment. But more so when you see you are making a difference in people's lives. So for me, the feeling that I'm making a difference in people's lives has been my high point. I have been able, through the research that I have done, I've been able to inform policies and programming in Kenya, and also to inform across Africa. I mean, we do research across Africa, although most of my work has been in Kenya and East and Southern African region. But yes, so my highest moment is when I know the work I'm doing is influencing lives, it's transforming lives. Okay, when I went to the university to do the Bachelor's of Science in Environmental Health, I kind of did not feel very happy. I didn't feel that that's what I wanted to do at the time. The only thing that made me happy, it was because it was close to medicine. And so, because as I told you, as I was growing up, there was that thinking around doing medicine. And so when I was admitted, I kind of felt a bit negative, but then I got excited also because it was in a good campus, the town campus where we were working. We were with the medical students, and it was removed from the main campus so the kind of life in the town campus was a good life. So I didn't, but then when we continued, we were the pioneers in the program, the environmental health program. And I kind of, along the way, I started wondering, why did I accept to take this course? Because it was, we did not get the kind of training that I was expecting in a university, the kind of mentorship. I did not feel that I got it well, or we got it well as a class. We even went on strike at some point, alleging we don't have good training. The training we were getting was not adequate. And so sometimes I kind of thought I could have looked for something else at the time. When I accepted to do the degree in BSc Environmental Health, I could have opted for something else. I could have looked for opportunity, but I did not do that. So I felt through those 4 years, I felt like I was doing the wrong thing, and kind of sometimes regretted why I didn't think of changing. But I can say all that ends well is well. So after all this, it's been all successful. So I think I'm okay at this point. I wouldn't say I regret anymore. Like at that point, I regretted why I didn't change. I didn't look for opportunities to change and do something else. But now I think it's all that ends well is well. I think what I could tell myself if I was to go then is to actually be proactive in deciding what you want and look out for that opportunity. So I just complied, I accepted what I was given, because I had not applied for this course actually, because it wasn't in existence at the time we were in high school. So it was something that was new, and so I just accepted to do it. But now, I mean, if I was to advise someone, I would tell them, look, be proactive, fight for what you want, until you can't get it, but at least do attempt. Okay, so as I said, I have been doing a lot of research in maternal and child nutrition. That has been my main focus when I have been at APHRC. I have done especially a lot of research in Kenya, amongst the urban poor particularly, but also in other settings, in rural settings. And I have been trying to to establish the situation of nutritional status amongst women and children. but then also looking out for strategy, doing research on strategies to optimize their well-being, to optimize nutrition for women and children. And through the research, I have been able to inform several policies that are related to that. For example, the baby-friendly community initiative, I spearheaded the research that was done to inform the guidelines that were published in 2016. I have also been on working to inform other strategies like the workplace support for breastfeeding guidelines. I have done research that has informed that. And one of the latest is the human milk banking. You may have heard about the human milk bank at Pumwani Maternity Hospital. So we've been doing research behind that bank. And so, so how I have influenced the society is really around just being able to find strategies and informing policy and programming around maternal and child nutrition has been, it's what I have contributed most to the society. And through my research, I have realized that one of the drivers of poor nutrition is actually food, the issue of food. And many women, for example, have told us the reason why we do not optimally breastfeed, the reason why we don't feed our children optimally is because we do not have food. So we have, like in urban poor settings, they say we don't have food, so we can't, it's difficult for us to breastfeed optimally when ourselves we are hungry. And some of them say we have to go look for work to be able to have food in the household. So we can't just stay back and just breastfeed the child. When you talk about exclusive breastfeeding, because the mother needs to breastfeed the child exclusively for the first 6 months, according to the World Health Organization guidelines. So I have realized that food is really very important, and have started working to research on that, to do research on that, and to really find opportunities to optimize food security in communities, and particularly in urban poor settings. And so my current work is really focused on integrating nutrition-specific and nutrition-sensitive interventions. Nutrition-specific being interventions like nutritional counseling to advise like mothers on how to breastfeed optimally, how to feed their children optimally. Then nutrition sensitive being looking at other interventions that would promote breastfeeding. They are not the immediate, but they are within the underlying factors like food security. So promoting food security would impact on nutrition. So we can't just tell mothers to breastfeed optimally if they have no food in the household. So I have now started looking into that space. Advantages is really the opportunity to change lives, to influence policy, to influence programming, and to change lives of people. For me, that, as I said, is one of the things that make me happy when I think about my work, my research, because when you do research, you inform change. So informing change in policy, in programming, and transforming people's lives is one of my greatest advantages. Of course, I came at a time when there is this whole thing about gender, promoting gender equality. And so whenever there are opportunities, they often encourage women. So I know that whenever I have applied for opportunities, I may have been lucky that there is this whole idea of equality, and so women are considered and they are encouraged to apply for these opportunities, and have been able to get many opportunities. And a disadvantage, as of being a woman in science, we have many responsibilities. We have a lot of responsibilities in the reproductive space. At home, we have the responsibility as a mother, taking care of your children, many things around that. Being a wife, it has also its own a lot of responsibilities. But then at the end of the day, you still have to do your work as a scientist. So we have to juggle between this research work and the work at home, the reproductive space. So like when I was doing my PhD, okay, so I told you I came to APHRC as a research trainee and were given 2 years to be able to get a place for PhD and go for PhD, so 2 to 3 years. So so at my 3rd year, I was now determined I need to go I need to get a PhD placement. And as many of us know, doing PhD like here in Kenya is very difficult. And I didn't want to do my PhD in Kenya because I didn't want to spend too much time waiting to finish. I have had many people talk of those challenges. And so I wanted to go outside of the country. We hoped that we could get opportunities where we could go as a family, but those are not easy. And so I had to leave my family behind. My child was 2 years and some months, 2 years and a few months. And I had also to leave my husband behind. So I had to go on and combine the two. So I knew when I went, I knew I had to finish this PhD within record time, at most 3 years. But and then when I was doing the PhD, my supervisors were very understanding, and they allowed me to juggle between my responsibilities as a mother, as a wife, and as a family member with the work I was doing for the PhD. And so I used to stay in South Africa for 3 years. I come to Kenya for 2 years. That was my life. So I had to come and go, and that was my life. And of course, we had to keep in touch with my husband so that we can talk and also talk to the child and all that. But yes, those are some of the disadvantages that you are a mother. I mean, many times you, as a woman in science, you're a mother and a wife and also the scientist. And you have to juggle between all those. And so that, for me, is one of the difficult parts. Of course, even today, as I try to progress, there are all those responsibilities that I still have to balance. I'm very keen on promoting justice. That is on top of my table now. And I'm very keen on human rights. I'm passionate about particularly to food. I really want to promote the right to food. I want I want to see everyone access food. And so I have entered into that space of human rights and promoting justice, promoting the right to food. And as we speak now, the current move is to really advocate for have a paradigm shift, change mindsets around the narrative about food. Food has been commodified so much that it's now just a commodity, and many people who do not have money have no food, because if you don't have money, you don't have food, because many times you have to buy food. And I want to drive some narrative change around the commodification of food and recommodification of food, making food be considered. So we know that food is a human right, as indicated, as recognized in the Universal Declaration of Human Rights and also in the international conventions, which we are party to in Kenya. We have, and many other countries are party to those, to the conventions. It is constitutionalized in our constitution. We have a right to food, and it's constitutionalized in many other countries. But many people sleep hungry. Like you had during this COVID time, you heard of that woman who was cooking stones for her children. Really, that should not happen in a context where we recognize food as a human right. Nobody should have to sleep hungry. Nobody should have to cook stones for their children. So I really want to drive that narrative change. I'm driving a change towards having universal food access policy, so that people can be supported to be able to produce their own food. And for those who are not able to produce their own food, they are supported to be able to access the food. So creating the right environment that people can be able to access food. Also recognizing food as a public good, in which sense, and as a human right, where the government has a responsibility. If people do not have food from production and they are not able to purchase food, they are vulnerable, then the government takes responsibility to ensure that everyone can feed. So I saw yesterday there was this budget that was allocated to food security, which is a good move. 60 billion, that is a good move. We want more of that. We want really more of that, and to ensure that we have like safety nets, social protection, so that the most vulnerable, like that woman who was cooking stones for her children, she can get support so that she can be able to have food for herself and her children. So really, that's my next fight. I want to lead the fight against hunger, to zero hunger by 2030. That's my fight at the moment. I really want to be in that fight and to be a leader in that fight against hunger towards zero hunger by 2030, in line with the Sustainable Development Goal number 2. Actually, just to add to the fight, to the promotion of justice, to building this legacy of justice, I went back to school. I actually went back to school to study law, and particularly interested in human rights law. And so currently I'm a lawyer also. And so that's where I am. And I hope that I can lead justice promotion. I don't have my personal experience with the issue of mental health, but of course, if you did assessments on mental health using the tools that I used, you may find that even those people who do not think they have a mental health issue may actually have a mental health issue. But I haven't had any mental health issue that has been identified, but I have interacted with people with mental health issues. I work amongst very vulnerable people and communities, and who are juggling with very basic issues. The issue of food, the issue of not sleeping hungry, or the issue of sleeping hungry several days. So maybe I can give an example of a friend that I had when I was in Moi University. As I mentioned, I had a friend in Langas slum in Eldoret. I used to visit her and her family. They lived in Langas. She had 2 children, and she was living in real poverty. And whenever I visited them, sometimes they didn't have anything to eat. Sometimes I took food to them. Sometimes they didn't have anything. Sometimes when I went to them, they kind of warmed some water and put some tea leaves, and they couldn't even warm it adequately because that means fuel. So they just warmed it. They didn't boil it. So sometimes I feared actually taking that tea. So it was just tea, water and that black tea. And as I took it, it was really real poverty, if I may say. And the driver for that, this lady lived in some good lives before. She was married, but then she separated with her husband, and then she lost her job. She used to work and she lost her job. She kind of went into abject poverty, this real poverty, after living a good life before. And so this was really stressful for her. She had bouts of mental illness. She used to actually go, like what people say, go nuts. Like sometimes you find her on the streets, and at that point she has lost it completely. And she was taken to mental hospital. There was a mental hospital at Moi Teaching and Referral Hospital. There was also a mental hospital there, and several times she used to be taken there and stay there for several weeks because she had a problem. So that was it's not, maybe it wasn't my first interaction with people with mental health, but that went deep. So this whole issue of struggling to find food, struggling to really just take care of her children, really made her go to that depth of mental illness. More recently, there is also another lady that I know who lives in Kibera. She during this COVID-19 period, she kind of also went nuts, if I may use that term, nuts. But what I mean is that she got that mental health problem. And this has been a very difficult time because people have really struggled with food, they have lost jobs. People who work these casual jobs, it has been a very difficult time. So that person I know personally who was normally started like having those problems, it's the son who called me and told me the mother seems to have a problem, and wanted me to give them some money and several times asking for food and all those kind of things. So, but this is not an isolated case. We have done some research in Korogosho and Rwanda, in the slums of Nairobi here, about the impact of COVID-19 government response measures on human rights, and particularly the right to food and food security. And what they have said, that this period has been very, very difficult, and the response measures did not consider their needs. They were not cognizant of their needs. They were not aligned to their human rights. And many people, of course, are hungry. Many people are very hungry. People have lost jobs. They don't have money for food. And they have said that this has resulted to a lot of mental health issues, a lot of fights within families, a lot of gender-based violence, because now people have come from everyone from their productive space. Now they are all in this reproductive space. The woman, the wife, and the husband are together, and there are a lot of struggles. So it has resulted in a lot of these fights in families, and but also just the fact that people do not have jobs and don't have food has also resulted to mental health issues. So I can say, of course, that's not my only experience with mental health issues, but that's what I can say for now. Okay, so volunteer work. I volunteered, as I said, when I was doing my master's. I was looking for an opportunity also to get to fund my study. So I wanted to do my study amongst the refugees, and I wanted to find ways of controlling malaria for them. Malaria. That time I was interested in malaria, and so I got a volunteer opportunity with the Care International. So I went to Dadaab refugee camps, and I stayed there for several months, 6 months. I conducted my research during that period. And so I was a volunteer. So I was working within their programs as a volunteer. I also volunteered to do teaching practice in the refugee schools. So I was also a teacher. I used to teach biology. And for me, probably all those things come together. Like when you have your CV, when you put, there were times when that was the most important thing in my CV. Like when I was looking for a job at APHRC, there was no other. Of course, I did those other jobs that I told you. I used to do some contracts with the professors. I mean, some research with professors. I also did some contracts with when I was tamarking, when I was looking for a job in the year that I went back to the university. I did some small jobs here and there, doing research and all that. But that volunteer job was an important one. It is one of the substantive jobs that I had done before I got the job in APHRC. But I also did an internship with the Ministry of Health for 1 year before I got my job at APHRC. It was not paid. It was a free kind. It was like a volunteer kind of internship. And so all those two opportunities gave me exposed me to work, even if not paid. At Care International, I was being given a stipend, so it wasn't too bad, but it was still voluntary. So we at APHRC we have internship programs. We don't call them volunteer programs, we call them internship programs. In the past, we've not been paying for anything. We have just been giving people opportunity to come for internship. It's an opportunity to start working, and many people who came as interns got their way through a job at APHRC when opportunities became available. But more recently, we have decided to formalize those internships, and we are giving a small stipend. And right now, for example, in my unit, the unit that I lead, we are admitting 4 interns whom we are going to stay with for 3 to 6 months. We give them a small stipend. We work with them in the projects that we work in for them to get exposure to research, to work. So that also gives them an opportunity for work. I know how difficult it is to get a job in Kenya, really difficult. As I said, I tamarked that 1 year and I knew what it was. So I really also want to give people opportunity for exposure to work even before they can get their substantive job. This promoting universal food access. And we want to ensure that, to see everyone access food, whether you have money or you don't have money. So we want to really help in the reconceptualization of food, so that food is seen as a basic human need and a basic human right that everyone should be entitled. And I have been co-opted as a co-lead in there is this UN summit that is coming up in September, and so the UN Summit for Food Systems. It's a food systems summit, and we want to present this idea of this policy at the UN summit. We want it to be presented. Of course, at the UN summit now, it's the member states that are involved in that, but we are now developing the idea, and we want it adopted and presented at the UN summit for adoption by member states. And we hope that will be adopted so that governments, states can consider food as can consider having a policy for universal food access. We know about universal education. Like now here in Kenya, we know that every child has a right to education, and the government has put in place measures to ensure free primary education and free secondary education now. We also know about the universal health coverage. So we want food to be put in the same compact with universal education access and universal health coverage, because food is so basic. Food is such a basic human need. It is a basic human right upon which many other rights are based. Like they rely on that right, like the right to life. You cannot talk of the right to life if you do not have food, because if you don't have food, then it means you can't live long. You can't live any longer. I mean, of course, after a few days, if you are not eating, you may get sick and die. So really, food is very basic and very important, and it should be put at that level. And we hope that will be adopted. So we are starting, we want to start a movement here in Kenya to really facilitate that reconceptualization through so we have a vision for 2050 for Nairobi, which we want to promote food security, starting with the urban poor in Kenya, but we want to really promote food security across the socioeconomic divide. We know the urban poor are struggling with just getting food to eat, just the food itself. People in other settings, even in the top up market, are struggling with like quality of food, safety of food. We want to really promote access to safe, nutritious food for all, starting with urban poor and also across the socioeconomic divide. So we really want to start a movement which promotes universal food access and the right to food. And we will be calling on everyone to join us, the public, policymakers, researchers, the media, everyone to join us in this movement and promote this. One advice I would want to give them is advice that I was given by my mother when I was very young. I mean, she always told me this. She always said in my language, if I could say it, in my language, she used to say, and when I translate that in English, is nothing good comes along easily. And she kept using that. And what that means is that for you to get something good or to succeed in something, you really have to work hard. It's not easy. You have to work hard. So she kind of inculcated that in me. And when all through my journeys, through all these journeys from when I was still a very young, when I was still in primary school, I had to work hard. I know there are sometimes I burnt oil, even when I was in primary school. I remember when I was working to really ensure that I get good grades. That continued all through my high school, my campus. Nothing good comes along easily. I had to really continue working and encouraging myself. And that also at my work, when sometimes you have to work hard for that proposal to be successful, it takes a lot of effort. It's not easy as a scientist. It's not easy. Nobody meant that it's easy. It is not easy. One has to work hard. But there is good reward. You work hard and you really put your effort in, you will get good results. So that is like the advice I give to myself. I always use that to myself, and I also give to other people.